what is that weird hanging down piece of fat or flesh or whatever under your armpit after your mastectomy surgery? Hi, I'm Sherry from Twin Sisters Mastectomy Boutique, and I am not a doctor or a nurse, so I'm going to do my best to explain these things. But if you're a doctor, a nurse, a healthcare provider, and you want to chime in, please comment down below. But that weird thing is called a dog's ear. And it's called a dog's ear because they've taken out some lymph nodes in this case, and they have kind of created a hole, and now they're sewing up that hole, and it doesn't sew up evenly. It puckers. And so a lot of my clients will come in and they'll say, oh, you know, I need to lose weight there. Losing weight's not going to help because it's now a flap, and it's a flap of an area where that's being cut out, and so it appears like there's hanging flesh, because there is hanging flesh, and it's not going to go away. So the only way to get rid of it is to have a revision surgery to get rid of it. But I'm not really sure why surgeons don't take care of that flap at the time of the surgery when they're taking out the lymph nodes and they're doing the mastectomy. There's probably a good reason for it. I know some surgeons do it at the same time, and some surgeons will do it at a later revision surgery. I'm not sure the answer to that question. So if you know, again, leave your messages below. But here's what I suggest to my clients. Because I see a lot of people who are coming in to see me before their surgery. They're getting their post-op bras to wear home from the surgery. And, you know, you don't know what you don't know, right? So if it were me, just me, I would ask my surgeon, can you like not leave me with a dog ear? Because that's what it's called. It's called a dog ear. It's a weird name. Can you like see if you can leave me without a dog ear? Now maybe they can and maybe they can't, but at least it'll be top of mind. They'll be like, oh, okay, let's take care of that while they're here, because your surgeon is there to save your life, right? Your surgeon is there to take the cancer out, remove it so that you can live a long, prosperous, healthy life with your friends and your family. They're not probably really concerned with this piece of flesh hanging over, right? Like that's not their main concern. Their main concern is saving your life, and they do a fantastic job of that. But, you know, you're left with this thing hanging, and it bothers a lot of women. They stop wearing tank tops, they stop wearing bathing suits, there's all sorts of things. And once they get that removed, if they choose to get it removed, then they feel a lot better. But it's an extra surgery if you have it revised, right? So a lot of women are like, I don't want to go through an extra surgery. My body's been through enough, you know. So my suggestion is, if you can, have a discussion with your surgeon and say, can you see if you can leave me without a dog's ear? They'll know exactly what you're talking about. And if they can, they can. And if they can't, I'm sure there's good reason for it. But it just makes life a little bit easier when you don't have that thing hanging. And it's something that nobody tells you about. It's something that nobody discusses. And, you know, a lot of women who come in and see me, I see this dog's ear because of their bras, and then they want like wider bras to hold it in and all sorts of stuff. And I'll say, oh, that's called a dog's ear. There's probably a more technical name, and this is why it happens. And they're like, oh, nobody told me. Like, I just thought it was, I'm fat there, and I just thought I needed to lose weight, and nobody knows about it. And everybody thinks that they're kind of like the only one. Do you have a dog's ear? Did you get it revised? Are you learning to live with it? Does it bother you at all? Let me know in the comments down below. Yeah, and if you are a surgeon, maybe you can explain why some surgeons leave it there. There's probably a good reason. I don't know. Don't forget to like and subscribe. A lot of people watch this channel, not so many subscribers, and I think people are a little shy about subscribing, but if you can subscribe and share these videos with your friends and family, especially if you know somebody who's going through this or who's had mastectomy surgery, pass this video on, because they may not have even talked to you about the dog's ear. You might not even know it exists, but they will. Anyway, don't forget to like and subscribe, and we'll see you soon.